Hi everyone. Paracetamol is one of the most commonly prescribed drugs worldwide. It is used as an antipyretic and analgesic in the treatment of pain and in the fever. Paracetamol is generally safe in normal doses, but it can lead to the liver toxicity if it is used in overdose. So let us discuss one of the commonly prescribed drug paracetamol in today's class. Paracetamol, it is also known as acetaminophen. It is most commonly used over-the-counter drug or analgesic and antipyretic drug. Analgesic activity is exhibited by activation of the vanilloid receptors TRPV1 by its metabolite. Now coming to the mechanism of action of paracetamol. Paracetamol inhibits the COX-3 subtype of the enzyme in the central nervous system, and it decreases the prostaglandin synthesis, and it decreases pain perception and fever. Paracetamol is having a minimal effect in the peripheral tissues, and that is the reason it lacks anti-inflammatory action. So paracetamol is equivalent to aspirin in terms of analgesic and antipyretic action, but it is not having any anti-inflammatory action. Now coming to the adverse effects of the paracetamol. Adverse effects of the paracetamol you can remember with the help of very easy mnemonic, and that is liver. L stands for liver toxicity. So in overdoses, paracetamol can cause liver toxicity. Then I stands for increased hepatic enzymes. V stands for it is generally very safe normally. Mild nausea or GI disturbances can occur. Otherwise, it is very safe drug. E stands for excess of the dose is harmful. That is more than 10 gram of dose that can lead to the serious toxicity of the paracetamol. And R stands for rash in the normal dosages and renal toxicity when it is used in overdose. To summarize the adverse effects of the paracetamol, it is generally safe drug to use in normal doses, and in overdoses it can result in liver toxicity and renal toxicity. Now coming to the acute paracetamol poisoning. Paracetamol is generally safe to use in all the age group, but in the children, the glucuronide conjugation capacity is limited, and that is the reason children can suffer from paracetamol poisoning if it is used in overdose. In the adult of more than 10 gram of dose, paracetamol can result in toxicity. In chronic alcoholics also, alcohol can induce CYP2E1 enzyme. So paracetamol will generate toxic metabolite, that is NAPQI, and glutathione stores is already depleted in alcoholic patients. So these all factors can aggravate paracetamol poisoning in chronic alcoholic patients. Now, if the paracetamol poisoning is not treated immediately, then there is an increased risk of severe liver damage. Let us understand the mechanism of toxicity of paracetamol with the help of this figure. Paracetamol, when it is normally metabolized with the help of glucuronide and sulfate conjugation, and it will be excreted in the urine. Now, if paracetamol is given more than 10 gram of doses, then this glucuronide and sulfate pathway will be saturated, as the liver is having the limited capacity of the glucuronide conjugation, and this will divert the paracetamol metabolism to CYP2E1 enzyme, and that will lead to the increased generation of toxic metabolite, that is N-acetyl p-benzoquinone and that is NAPQI. Now this NAPQI is a toxic metabolite and which binds to the cells of the liver and to the cells of the renal tubules, and which ultimately leads to the hepatic necrosis and renal tubular necrosis. So remember, paracetamol in the overdoses can result in hepatic necrosis and renal tubular necrosis. Now coming to the treatment of the acute paracetamol poisoning. First of all, we have to give activated charcoal orally or through the tube to prevent the absorption of the paracetamol if it is of recent ingestion, and acetylcysteine by IV infusion replenishes the glutathione stored in the liver, and another is methionine drug. So for the treatment of the acute paracetamol poisoning, we have to give an acetylcysteine which generates glutathione, and this glutathione will convert this NAPQI toxic metabolite into non-toxic form. Now coming to the clinical uses of the paracetamol. So paracetamol is generally safe to use in all the ages from the infants to the elderly group, and also safe to use in the pregnant and in the lactating mothers. Apart from this, paracetamol is used in pain, headache, migraine, myalgia and dysmenorrhea. It is also used as an antipyretic drug for the fever in the children who are having a viral infection, and in the children with the viral infection, aspirin is generally contraindicated to use as aspirin can cause race syndrome. So safer alternative is paracetamol. Paracetamol is also used in case of rheumatic pain which is of mild severity, and it is also used as an alternative to aspirin in the patients who are allergic to aspirin. Paracetamol is also safe to use in the patients in whom aspirin is generally contraindicated to use, like hemophilia or peptic ulcer, or in the patients of bronchial asthma. So these are the clinical uses of the paracetamol, and that you can remember with the help of very easy mnemonic, that is para. So I have explained already what P stands for pain, A stands for antipyretic, R stands for rheumatic pain of mild cases, and A stands for alternative to aspirin. So this was about the paracetamol, and to summarize today's class, there is another very easy mnemonic, that is itself paracetamol, and P stands for pain relief. So paracetamol is used to relieve the pain. A stands for antipyretic action. R stands for renal toxicity in overdoses, that is more than 10 gram. A stands for alternative to NSAIDs, that is alternative to aspirin. C stands for its mechanism, COX inhibition, that is its central action. E stands for excess of the doses of paracetamol which can result in toxicity, that is more than 10 gram. T stands for its toxic metabolite, that is NAPQI. A stands for antidote, that is N-acetylcysteine, NAC. M stands for it is having a minimal anti-inflammatory action. O stands for overdose, which can result in hepatic necrosis, and that is liver damage. So this is the very easy mnemonic from the paracetamol name itself.